So now I'm introducing Cordyceps. Cordyceps is a natural mushroom, and Cordyceps is really amazing for your immune support. So if you have allergies, if you have asthma, Cordyceps is great. If you have thyroid issues, Cordyceps, again, is a great supplement that can help support your thyroid, as well as diabetes. So if you have sugar issues with regulation, Cordyceps is really a great way to go. Also, it helps with energy as well. So it's a great supplement to take in the daytime. You can take it with food, without food, and it's all natural. This is Katie Walker with Rethink with Revitalist, and you're here to change the narrative of mental health. So I'm here with two amazing guests today, Dr. Julia Mirer and Adam Marr. So Julia, Adam, thanks for being here.
Thank you for having me.
Great to be here again.
Adam just keeps coming back. Like, we don't know what it is. We're not even on drugs or anything.
You're not going to get rid of me.
He loves it.
I'm here for the long haul.
But yeah, I think today's episode, talking about kind of Julia's history, right, with Western medicine and where I come from that too, right? And sometimes we're looked at the bad guys. But then also talking about the psychedelic ketamine therapies and maybe the impact that they actually do have on the space and how's that evolving? What are the ethics with that? How are we making sure that people are trained correctly? So yeah, Julia, you want to give the audience a little bit of your background? And also Adam knows you from when I said, she did this lecture and it was called Don't Fuck Your Client. And I was like, and she had my
that's a good
heart.
title.
She had my heart.
That's one I can get behind.
Right.
Wait, that does not mean that.
Julia, tell us about you.
So I am a recovered physician. I got my medical degree. I always wanted to help people. And I thought going to medicine was the way to do it. And then when I got in there, I was like, oh, something's not right here. We're not practicing preventative care. And I was like, I'm working with children. I was in the worst psychosocial stressors. It was Harlem. And I'm like, we're not talking to these kids about their diet. We're not asking them what's going on at home. And then I looked around just the units and I'm like, we're fighting with each other. So all the departments are against each other. And I'm like, this is not healthcare. And so to the complete horror of my Russian Jewish doctor father, I resigned. And I joked that I left medicine to pursue a life of healing. And what that looked like for me was really exploring all these alternative medicines. And that included practices like proper nutrition, good sleep, self-compassion, mindfulness-based stress reduction, all these things that was not science according to the Western medicine model. And along my path, I also discovered psychedelics. And I was like, wow, there's something here. What is it? And I dove into the science. I had my own experiences, and I went through the usual process that people go through, oh, this is going to save the world. And it's like, no, it's not, but it's going to open up a door, and what do we do with this? So I ended up trying to get my hands on any literature, talking to people. When COVID hit, everyone was on a webinar conference, so I just started reaching out to anyone that I resonated with. And I kept saying, where is this industry going? What does it need, and how can I help? And during that same time, I started to myself understand, wait, 80% of the benefit of these medicines is really the preparation beforehand. And that looks like education, self-inquiry, kind of tilling that soil. And then the integration afterwards, which is really talking about your experience, making meaning of it, and doing this in a container that's really focused on forward movement. And with that in mind, I really just continued to navigate throughout the ecosystem, connecting people who are saying similar things, but experts in their own domains, because it became very clear that if we're going to move this forward in an ethical and responsible way, it's going to be collaborative. This isn't the cannabis industry vertical, we actually all have to work together, because this is an opportunity for us to shift how mental health care is delivered, because what we're working with right now doesn't work.
Adam, can you see how all of us have come together? As I've known Julia now probably for three years at least, I would say. But seeing Charles and Michelle and Julia.
Oh, I mean, I can 100%. I just sit here, just smiling, listening to you, talk through like your journey in this path of, you know, service through the medical profession. Phil, like what higher, you know, calling could you have, you know, to a degree to, you know, have the mental capacity and capability, the, you know, the hardship of the finances that go with our Western model to equip yourself with the, you know, the degrees and the credentials to be able to do so, to be able to go in there and just feel like you missed the mark, like it's not delivering, like you're not providing the impact that you want. And then like having the courage to be able to, and your dad was also your boss? No, okay.
But in life.
Okay, so I wasn't sure if you were like, yeah, in life, father, yeah. But you had to go and you had to tell him, and that was his profession too.
Yeah.
Right. And so, and then there's this conversation of like, you know, I can only imagine like what was that conversation like, you know, for you guys?
There wasn't much of a conversation for like a year.
Wow.
Yeah. And it was really interesting because the decision to leave was not a logical one. And psychedelics did play a role. I did not get the preparation and integration after psychedelic. I was told, I think you need this, and just kind of left to my own devices during one of my vacations. I came back from vacation, and 3 months later, I resigned. So I'm glad I left, but I definitely encourage people to stay because we need to change the system from within. But the conversation with my family, my brother was my big supporter, and my father couldn't possibly understand because to him, it's like you were so close. You're just like almost there to do the thing. And I'm like, but this thing is not what I thought it was going to be. And over time, I mean, now we have an amazing friendship. Like our relationship and our whole families never looked like this. And he now tells people to talk to me about psychedelics. Really? Yeah. But back then, like he couldn't see a different way. But what really started to change things was I kept sending him articles of like, here's the new evidence, here's the new things about psychedelics. And then the second thing was
it's like peer-reviewed articles. Yeah, exactly. Johns Hopkins, Stanford, Harvard.
Yeah, the
maybe you've heard of them, Dad.
Yeah, exactly. And the other thing was, I remember I had a conversation that was like, Dad, he was my hero, and he is my hero. The way he cares for his patients, they have his cell phone number. He's a pediatric neurologist, so they know that they could call him with something, and that is not the typical physician. But even for him, I remember he told me the story of, you know, a patient comes in and they're complaining about how he's managing their child's asthma. They're demanding medications that are not intended for asthma. And he's like, it's not worth the fight. And when I told him, I was like, I couldn't imagine my life practicing medicine this way, where they come and tell me what I'm supposed to be doing, and I don't feel empowered enough to say, no, this is not the proper treatment. Like, he was able to do it and make sense for him. I was like, but I couldn't imagine doing that. And this is what I came across a great video about moral injury. So they talk about physicians burning out, but it's like these people have been through the ringer to get to where they got to. Is it really burnout? Or is it the fact that you're coming in and day out doing things that you don't fully believe to be true, don't fully believe is for the benefit of the patient, but if you do it any other way, this is a liability. And so we're put in this position where even if you learn new things about psychedelics or about holistic treatments, it's not the standard of care. If you step outside of the standard of care, you risk being sued. You're either a hero or you're sued. And not too many doctors are willing to risk it to be the hero anymore, because the suing career
destroy you and take everything from your family. Right.
Yeah, that's a great point you bring up around the moral injury, and this is a term that I just kind of learned in probably like this year, I think, for the most part. And I had a good buddy, and he was with us, you know, down in the British Virgin Islands, and same as Ryan Roberts, and he was a Marine, and he had to go and do like some of the worst things and experience the worst things of like, you know, war. And he was talking about not so much like the PTSD side of things, but really the moral injury of like what he had to do. And that makes like perfect sense, the analogy that you're drawing, like with the doctor who's wanting to go in and provide this, you know, level of care and lead somebody to be able to heal from whatever they're experiencing, and then like being constrained by like the system and this allopathic way of like medicine is not producing the desired results and going against like your core values. So it's like you're betraying like yourself and what you stand for meanwhile, like when you were there to do a certain thing that you thought that you're not getting to do, well, now there's this internal conflict and people have to figure out ways through that. And so like what are the ways, you know, that conventionally that happens? They lose a part of their soul in order to maintain that security. And then they have to convince themselves that they don't believe what they believe. And then they go down, and that's a path that they could choose. And what are the ramifications of that for themselves, for their families, and for the practice, and for society? And then the inverse of that, which I'm interested to hear a little bit more about, was like, you know, you had that conversation with your dad, and you went on this alternate path. But you said it was a vacation where you were kind of ill-equipped, and it just kind of materialized. So tell us about that as much as you feel like, you know, sharing.
I was on vacation, didn't like have any plans of changing my life, but I had taken a leave of absence maybe 3 months prior, and the leave of absence actually came at a time when I was in my second year, which means I got a weekend here and there, which we called them golden weekends if you had both days off, and yeah. And so I started thinking like something feels off, and took a leave of absence, started medication. My therapist was like, you only need meds for 2 years. Residency sucks. Like, you'll be fine. And what ended up happening was I went on this vacation, and someone that cares about me very much said, it was like, I think you need this, and just handed me some psychedelics. And so for me, it was psilocybin. And I was like, okay, cool, whatever. It's a drug. I did it. I didn't think anything of it.
Yeah.
Just like the ocean expanded for like 5 hours. And
So you were at the ocean?
Yeah.
Oh, wow.
And so what ended up happening afterwards was really why integration is important.
Right.
But I came back to my residency, and a few things happened. One, I became super aware of everything that was not going right. The toxicity amongst the team members, the failure to listen to patients, all of these things become like unbearably present. Yeah. And so nobody told me like, hey, the things that are a little bit, you're going to be very aware of them. And the experience that I had, even with patients, there was like, I had patients that I couldn't understand verbally, like based on my clinical training, what was wrong with them. But there was like some gut feeling that I finally had a connection to.
Oh, wow.
Which you tend to lose that gut feeling when you're on antidepressants and any kind of medications. But all of a sudden this gut feeling was back. And then I was also, because I'm experiencing all these like negative things, starting to get worse. And my therapist calls me and she's like, hey, I want to increase your medication and add a mood stabilizer. And that was my first alarm where I was like, hold on, you told me I'm only going to need this little bit for 2 years. I was like, if you're telling me something else, I was like, I promise I'll call you in a week. Let me think about this. And it was an experience that I remember to this day. This was over 6 years ago, where I had the running dialogue in my head, which most people in this medical profession have this, like, okay, I can't leave because it's career suicide. I'm going to disappoint my patients, my program, my colleagues, the people who like are like in the hospital, my parents, my family. All of these things were running my head. And then there's this one moment when it goes, like this other voice goes, how are you disappointing yourself by staying?
Ooh.
And I've never heard this voice before. This was like, you want to call it the higher self, the soul, whatever it is. But I had no other answer, but I'm disappointing myself in every way. And so when I say it was not a logical decision to leave, like, I mean it was a spiritual, it was like this guidance that said, this is not where you belong. The wildest thing that happened, like I set myself up, I resigned. And then there was this moment where I was on a phone with a friend and I'm like, dude, you don't even know what you're about to witness right now come out of my mouth. I was like, I just remembered something I used to say from 17 to 19, around that age, that was, I feel like I'm meant to do something great that's going to cause a paradigm shift in some aspect of medicine. And it may not be as a doctor, but it's definitely via the med school route. And
you used to say that when you were 17 and 19?
17 to 19, because I've always wanted to be a doctor. And then I may have even been my dad that said, like, oh, childish idealism, just do what you got to do.
Right,
like,
yeah.
Keep going.
Just
keep going. And so when I had that moment, I was like, hold on some level, I knew medical school was important, going that route, but it wasn't going to be as a doctor. And so that became my almost like a mantra, that anytime it was like things were tough, I'm like, oh, the easy thing is go back to residency, finish that year, and then go on. But every time it was like, that's not what you're here to do. And so I realized that my experience is important. I learned the language of doctors. That's a very different language. I know how to talk to them in a way that doesn't trigger their alarm bells, but actually inspires them to listen. Like, I know you can't offer this for patients, but be aware of what's going on. And I think one of the coolest parts is, like, maybe on some level I was meant to be an investigative journalist, and the only way to get the scoop on a doctor's ego was to become one. And it makes sense now, because so many people say, like, oh, but I brought this information to my doctor, and they dismissed it. Well, I'm like, of course, because your entire training, you are told that you're nothing. Like, in the beginning, you're told you're nothing. You're lucky you're here. Just the whole process of matching into the programs is like, you're my favorite. Like, to every single, they're just lies. Everything's just built on like this intense dynamic. And then for 3 years, you are, there's a term called pimping, where you ask a question and they're going to pimp you on a different part of the question in order to make sure that like you really know where you stand. I don't know. But
terrible terminology, by the way.
It's true.
Yeah.
Yeah. We eat each other in the medical field.
Yeah.
And it's like, so you have this happening. So for 3 years, that's your basic training residency. Then you go into your fellowship if you like specialize. And so this whole time they're telling you you're nothing, you're at the bottom, you're this. But when you're done with your training, you are knower of all things.
Well, this is such parallels to the military, like, in its own way. You're coming in and you have to take everybody through this like standardization of like, you're nothing, your name, rank, and serial number. And like, we're going to shave your head. We're going to give you this uniform. Like, you dress the same, you look the same, you march the same, and you take orders. And if you operate outside of that, then this system that we have in place will absolutely crush you. And we're doing it for your own safety and survival so that you can be the leader that we know that you're capable of being, right? And it's part of the training to indoctrinate, to be able to do our wartime tasks, to be able to be willing to, give your life in service to your country for your brothers and sisters, or to be able to take life. And it's funny that parallels in the medical field, which is very much the same under the guise of, being able to heal and provide this.
Language medical providers speak a lot like military.
My dad told me you're in the trenches with these people.
Yeah. Yeah.
And he actually was in the military. So
yeah.
And we don't show weakness. You show weakness, you get kicked out.
Oh, yeah.
Yeah.
Absolutely.
There's a cultural mindset, because weakness is equivocated to inability to perform when needed. And if you're not able to perform when needed, then that means lives are on the line.
Yep.
And if lives are on the line, then like, it has to be serious, and strength must persevere through all.
All the lives matter in the hospital except for the providers. And this, like, in my training, I became aware of these little nuances where it's like, you have an 8-month pregnant ER doctor, but because the Joint Commission coming to check all of like the procedures and making sure everything's like, no food anywhere, no water, because they were showing up that week, she wasn't allowed to have any water nearby her desk, had to be somewhere else that she would have to walk to. And it's like, we don't make exceptions even for this. She's working a 12-hour shift, 8 months pregnant.
Did you get in trouble with Joint Commission?
We probably always did, because like, I mean, this is, I've been in programs where they're like, okay, all students stay home this week. Like, they just didn't even want the liability of us there. But the sad thing is, like, you said for your brothers and sisters, like, for us, we can't be stressed. We can't have the negative consequences of stress.
Right.
But we tell all of our we will tell all of our patients that you have to take care of yourself first. But we can't do that, because we're there for the patient.
Right.
First. And that creates a very toxic state of, like, we're not trained to take care of ourselves as healthcare providers. And I think that's why we see a lot of, like, provider errors, we see, I mean, when I was leaving residency, our suicide rates were climbing.
Oh, yeah. Physician suicide's way up.
Yeah.
Yep.
And it makes sense because we're not aware of how, like, the stress affects us. We have this belief that we cannot leave the system that is making us sick. And we feel like there's no other option.
Right.
It ends up being like Stockholm Syndrome. You fall in love with the captor that is your...
Yeah. And then you have a fear. Like when I left the hospital, to do the ketamine stuff, it's like I had such big fears. Like I want to lose my skill sets. Like what if I do need to go back to do anesthesia, all these things. And it's like I'm going to lose those skills. So it's very, very scary. Probably the same way in the military, I guess.
Well, it's a very relatable theme. And I think it transcends, like medical, it transcends military. And it's a societal thing of like, these are the conventional ways in which people work within society. And, like this whole like 9 to 5, large corporate entity serving like one function within like accounting and finance or procurement or like whatever it is. I went to the coffee shop the other day and there was this like sweet, girl there. She was 18 and just trying to strike up like idle conversation. And, I think it was over the summer. And so she was getting ready to start college. And so I was like, well, what are you going to study? And she's like, oh, I'm going to study finance and accounting. I was like, oh, are you kidding me? I was like, is that what you're passionate about? She goes, like, I had asked her if there's aliens on the moon. And she's like, well, what do you mean? I was like, well, do you really enjoy numbers? Like, are you good at math? Like, why are you, you want a life in finance and accounting? And she goes, well, I'll just be able to get a good job. And I said, well, what were you passionate about as a child? And I kind of was like, left her with this, like, well, like you.
Then you got her to call her dad.
You know what? I do. I felt like leaving. Like I just
crisis.
But you know what? And then like on the spiritual side of things, like it was just it is natural to come out to try and say like, look, there's something that fills you with like joy, purpose, passion. Maybe you should explore that in this time. But I also don't want to define your journey for you. And I think like people get locked into like, oh, I should be this, I should do this, I should show up in this way. And it's like, no, I think that's how we have the society that we have today and the way that it's, structured. And there's maybe a better way. And what we're talking about here today is, the wellness side of things, like the healthcare and how you can take ownership in that. And we've outsourced everything, to the doctors and given them all the credibility and the time. And they take that, because of how we're trained and, all these allopathic ways of handling in the pharmaceutical to be able to provide, for that. And we've taken the ownership out of the individual to be able to know these practices and things. And, what I'm hearing is that like through your journey, like you got that expertise all the way to the point to where it's like, oh, this isn't what I thought it would be. How do I do the thing that I thought it would be? And now how do I help serve and what does that look like? And so like, what has that looked like, for you as you've kind of grown into it and how you're in what you do now for your practice, and what does that practice look like?
Yeah. So when I first resigned, in medicine, they tell you don't know anything until you've done it for 3 years. So I was like, okay. So from 2018 to 21, I dove into all the science. I dove into the self-help books, the Buddhist books, like anything that I could get a hold of. And mind you, when I was in medicine, I read 2 books from all of my medical school training and residency. And now I'm like a voracious reader. And I started noticing a lot of these things, they're all saying similar concepts. They will say it from a self-help perspective, from a religious perspective, right. But it all focuses, like you said, back on like who you are and what is your purpose here, what is your role. For me, I got involved with like various organizations as an advisor or consultant with early stage funds, I got to sit with patients for their clinical trial, psilocybin for major depression, which allowed me to speak openly about sitting for patients on psilocybin. And I was a director of strategy for ketamine clinic for 3 years. And this whole time I was paying attention to trends. And one of the trends that I noticed is like, therapy's great at making sense of the data points that are your life. Brings you to point A, gives you a story. But that story of your life and who you are could also become the diagnosis you carry as your identity.
So give me an example.
So if you come to the therapist, I don't know what's going on in my life. It's like, oh, you're depressed.
Yeah.
Oh, okay, I'm a depressed person. So now you go into the world as this depressed person.
Yeah.
And sometimes you get better, but like you now have this identity.
Right. Yeah.
Or I'm borderline.
Yeah.
Great. Well, what are you going to do with that? Well, no, I don't have to do anything because I'm borderline. So I could have these ups and downs. Like, it's okay because it's who I am. And so therapy can almost get you stuck in your story.
Right. Okay.
And when you're dealing with psychedelics, you have this amazing insight and you go back to your therapist and you could talk about the insight. I think that gets you at a certain point, but then it's like, okay, now what? And so I became very curious. I'm like, hold on, coaching is, like, you know, everyone's a coach nowadays, but like coaching does kind of focus on what's happening right now and then forward momentum. So to me, I'm like, okay, therapy gets you to point A, coaching gets you to point B. And after that, that's where life happens, past point B.
Right.
And so I went into get coaching training, basic coaching training, low barrier for entry, low barrier for graduation.
40 hours. Here's your certificate. Good. Go.
Right. Can you talk? Okay.
And to me, I'm like, okay, no, the concepts are good, but the training is lacking. Like, it's just trying to get people through the door. It's almost like a multi-level, like the MLM.
Sure.
But I still believe that no, coaching is very important when done right. And there's actually a lot of therapists getting trained as coaches because then they could wear both hats. It's like, okay, you've graduated out of therapy. I can support you in the next phase. And for me, I ended up getting supplemental training with a group called Being True to You, which have been working on psychedelic training for 12 years. Started with the hardest patients, the Ibogaine patients.
Ibogaine.
And the amount of information they shared, there's still the element of like, who's the one applying the things they learned? But I'm like, this is a training.
Right.
And for me, I've become a very big advocate for the coaching aspect because there's so much value in one, sitting in front of a person, believing in them. Because so many people that go through psychedelic treatments, like they don't have a single person at home that believes in them. So like the coaching is very valuable there, but it also puts the onus on them to figure out what's next in their life. Because with psychedelics, like I think we've all heard the typical analogy of like the ski slope. You have your old ways of being, of thinking, of doing, and those are like your black diamond, your green, your blue. Very well entrenched, like those are the pathways. And then you have the psychedelics, which is like a fresh snow. And the analogy goes on to say that you could turn around the tree and take a different hill because now there's less energy required to take a different pathway. I take that analogy further to say, if you don't keep taking those other pathways, when the snow melts, those old grooves are right there.
That's right.
And if you don't do anything with the psychedelic, those old grooves, like once the snow melts, they're all there. And so the most important thing for people after their ketamine treatment or any psychedelic is like, what are you doing afterwards? And how consistently are you doing it? Because it's taking you a little bit less energy to do it now. So like, keep going with that because that's going to be what continues your improvement, like what actually sticks once the snow melts.
So I just looking over at Katie and you're just like smiling and grinning. You're like from ear to ear. Oh, yeah.
Yeah. Well, yeah. I mean, she's saying everything I know, right? And it's like, that's the cool part, right? Is like, there's nothing voodoo about this. There's no like, oh, Julia's just pulling this out of her ass. No, this is consistently consistent. Like, it is the most scientifically based, and it's spiritual, emotional, everything that we've been taught doesn't exist. It does exist. And there's a consistent pattern that shows that it's true because you can get all of us in, right? But we all see the commonality with it. And yeah, I love that. And one thing I was thinking about, it's like, you know, when you all are talking about healthcare and military, right? We're taught to be machines, period. And we're very, very good machines. But I had a physician one time, I used to learn, I've always been the why kid, right? So I learn things all the time because I'm just asking random people random questions. And, but we were talking one day about a neurosurgeon who I absolutely love, adore him. And he's horrible to work with sometimes, but he let like 3 anesthesia people in his room and I was one of them. And, you know, and I was like, why is he, you know, we were talking about like difficult personalities and how I was good with difficult personalities. They actually blessed me with putting me with all the difficult personality surgeons. And that's not easy sometimes because there's a lot of ego in there. But what he told me, and it's really stuck in my mind, He said IQ and EQ don't develop at the same time.
Mm-hmm.
So when we're going through medical school, whatever else, right, military, your intellectual ability is improving constantly because you're in survival mode and you're having to build these skills. So you're becoming an expert in your IQ per se, but your EQ cannot mature at the same rate. That's why a lot of physicians have terrible bedside manners, because they don't know how to speak on that emotional level of. So really, it's like, when you come out of the military or you're in healthcare or whatever else, it's like we need to recognize, like, yeah, I'm an expert here, but I suck here, And if you think about, like, when you feel an emotion, we'll be like, oh, that's weakness. It's like, no. Feel it, identify it, and then that way you know what it is. And I've talked to some people. It's like, how cool would it be, like, in, like, kindergarten, right, that you get pictures of this child's, like, what emotion's this? What emotion's this? Anger, hatred, confusion, but, like, show these children, like, a standard, kind of standardized set of what an emotion looks like, because we're just allowing them to interpret those emotions themselves, and they don't know what they are, I mean, like, if you're sitting there talking to a child and it's like, I almost lost my mind over this. I took my daughter into the pediatrician when she was 11, and they were like, here, fill out these forms. And I was like, taking the forms, like, I'm looking like the crazy helicopter parent. And I take the forms, and they give her a PHQ-9, and they give her a CAGE questionnaire.
What? I don't know what those are.
So it's a depression scale.
Yeah.
And then they give her a CAGE questionnaire that's asking her about her alcohol and drug use at 11 years old, which the state of Tennessee is wanting all pediatrician offices to do. So they're all doing it. Zero education. You're giving this to my child who's 11, right? I record this because I'm like, this is just ridiculous, right? Because, right, what the questionnaires, what it says, how would you rank feeling? Do you feel like a failure? Well, an 11-year-old who maybe didn't pass a test yesterday, do they feel like a failure? Yes. Do you feel like you overeat or you undereat? How the hell do they know? It's like, right. So I'm sitting there and I'm recording. I was like, Gab, I'm just going to record you for this. Like, unfortunately, she's been really immersed in mental health since she was 8. But I would like talk to her about it, and it's like, about undereating or overeating. And it's like, give these children the definition. And then I'm asking her about her alcoholism, like, how many do you feel like, do you feel like you need a drink right when you wake up? Yeah. And she's like, a drink of water,
milk.
And it's like,
milk today, juice.
But but they give them this, and the health department thinks that they have now succeeded because we're screening for depression and drug use. And it's like, you are traumatizing them. It's the same way, right, with needles, because we're in ketamine, we're around a lot of needles. Same way when kids get their immunizations when they're little. Just hold them down. They won't remember. Yes, they do. They may not consciously remember, but their subconscious remembers, to where I've had engineers, like, they're like, it doesn't bother me, but, like, heads up, like, I'll probably throw up. Like, I had this response. They have like an internal visceral response to some type of traumatic situation that happened to them. And us, as these protectors, we're like, hold them down. They won't remember. It's like, yeah, they do. And I think that's something, we're all starting to see is like, how do we continue to mess up because our egos are leading the way?
So unpopular opinion. Well, no, don't care. So
this is the trust tree.
This is the trust triangle.
Are you fighting, flighting, or freezing?
Yeah, all.
This is a fight.
So it was a podcast that I came across, and the name of the podcast was like, "Why the Kids Aren't All Right." And everything is just, you could see the pendulum swing. And we, like, our parents' generations were like, children should be seen and not heard. Yeah. And then now there's this pendulum swing to, like, what's going on in your feelings today? Right. There's a happy spot in the middle. But what's happening right now is these questionnaires. If you start priming a child in 2nd grade, in 3rd grade, who doesn't ever think about, are their parents respecting them? If you start priming them to start looking for evidence of am I triggered? Am I being respected? Am I being disrespected? Then now you've primed them to look at the world through this lens. So now you have this epidemic of kids thinking that there's something wrong. There's something wrong. There's something when yes, okay, the world is burning and you can see it at your fingertips. But realistically, compared to their parents' generations and their grandparents, nothing's wrong. Like, they're not being exposed to, for the most part. I mean, racism still exists, but the degree of things that are offending children nowadays is much like people weren't offended by these things before. So there's an issue with priming kids to look at the world through the PHQ-9 lens, through this anxiety symptoms or like all of these things. Because then what happens? They take these questionnaires. These are definitely people looking for an identity. They go on TikTok and they're like, oh, this resonates.
Right.
I'm bipolar.
Yeah.
And again, that is you. Fine. You think that you identify with this? That is your starting point. That is not your destination. So if you're like, okay, I'm bipolar, what are the skills that I need to learn to regulate my emotions? That doesn't happen. It's like, no, I'm bipolar, so deal with my emotions because this is who I am.
Yeah. I need some medication.
Nobody's teaching us how to live life.
No.
Period. Yeah. No, absolutely. And people who are bipolar, my personal opinion is, it's anxiety and depression, and those just duplicate over time and then get way worse both ways, right? And it's because, we're told that mental health is out of our control. There's nothing we can do about it, and that's crap.
This is again where doctors have lost the understand because we feel so small in our roles. We forget how powerful our words are. So when you dismiss someone, oh, don't worry, you'll just be on this for the rest of your life.
Yeah.
That's a life sentence you just gave someone. But because you don't know how powerful you are, you don't leverage that relationship to say something that empowers the person. And there was a great book about the placebo effect, which I think is a birthright, not a dirty word. But it was like, imagine if in order to get your medical degree, you would have to make a placebo work based on the story you tell patient. So like almost learning how to leverage that dynamic to empower someone to heal from within, from whatever it is, that belief, like instill some hope in them. But because doctors feel hopeless, their patients feel hopeless.
Well, I think the wonderful thing, at least like on my own journey, and I think the credibility, of these medicines in the Western world is like coming off the backs and the work of, people like you guys and in what you're doing to be able to bring that Western perspective, but then apply it in a way that's like, palatable. And I think that, the work that you're doing to help somebody on the front end and the back end is so important. Like the first psychedelic I ever did was ayahuasca. And I did no preparation for it. And I did it for 3 consecutive nights. And I did it on the weekend of September 11th. And that's a whole nother podcast. But then like my second one was ibogaine and 5-MeO-DMT in Mexico. And I was just like, okay, if you're going to climb a mountain, just go to Everest, right? Or K2, do them both. And there was support that we were there, like an integration circle right the next day, kind of thing. But I went right back into my environment. Like I didn't really understand this 7th level chakra blowout, that I had experienced, and how I practically like bring that, back into reality and what that means, and all the things that like we're talking about here that we're still impacting, the inability for me to unwind, my program and the things that weren't serving. So 3 years later after 2 years later after ayahuasca was the 5 and the ibogaine, and then 3 years after that I was in this terrible state again. And it wasn't ultimately until I proverbially to myself said, Dad, I'm not going to do this corporate consulting anymore. I'm not going to do the doctor work. I'm going to go and pursue this purpose-driven work, and I don't know how it's going to land, but I know that if I keep doing this, like my soul is dying here. So there's this very like arc and trajectory of, these experiences, work, the academic knowledge versus experiential, putting it into practice. And I have children all along the way, right? And so, they're experiencing and seeing some of this. But one of my intentions was being able to do the work that I needed to so I could provide the healing that my family needed and whatever that meant, to us. And so that I could also help my children as well. And that has grown and evolved. And I realized like I can't transfer the knowledge of all the things and these experiences that I've had, but I can really tune into them and their individual, beautiful like soul and self to really find out, how they're thinking and experiencing life right now. And then like from a loving, parental, like values-based approach that me and my wife decide we're going to, parent our kids with, I can introduce like concepts and ways of thinking for them to frame and reframe and approach things in a different light. And it's more sophisticated for my 13-year-old daughter on like what we talk about and the walks we take and how we do that, that it is with my 7-year-old. Like just last night, my 7-year-old was just very easily agitated, and very like needy, where anything would cause her to, go into this like crying spell. So I just kind of like pulled her into the kitchen with me. We got a cup of water. We made some chips and queso. I just started talking to her like she was an adult and walking through it. And once she got out of her emotional state, then we started asking her questions about, why do you want to respond in this way? Do you feel like you have control? Do you feel like it just comes on? And she was calm enough to start kind of like describing, what it was. And then, so once I had her there, I was like, okay, now we can just let's give her like a little tool to happen when these things. And then I swear, like she went and had a bath, came in, something else, and something didn't go her way. And she had the most positive attitude. And I said, wow, Dad's so proud of you. How are you able to do that? She goes, well, I just do what you told me to do, Dad.
Awesome.
Yeah.
It's true though,
Yeah.
but you had the time, right? And actually, we talked about child psychologists on a previous podcast. Like he told me, he's like 20 minutes. That's all you need with a kid is 20 minutes a day. So just that small interaction, right, is such a pillar. And you recognizing that instead of being like, oh, I need to get her, she's got behavior problems.
Yeah.
I put her in a therapist. It's like, no, you talk to your kid, like, and people are afraid to talk to kids. They're like, I don't know what to do with them. Well, surprise, you were at one time a child. So it's not like you didn't live that before, right? And people, somehow we've made people feel afraid of themselves and afraid of their kids and afraid of their parents. And what if I say something wrong? And it's like, not saying anything would be the wrong move. At least giving it that like eye connection, like the value that like I'm here with you, I love you, I'm trying to, that like that's what we've lost, or maybe we've never learned.
So I think that story is amazing because for children, they have all the same emotions as an adult with zero tools to process them. And so they are dependent on their caregivers to like model how to regulate emotions. And most parents don't have that for themselves. How are they going to model it? So these kids become afraid of their emotions. If you're a kid and you're having this big feeling and your parent wants to make it stop, then you learn this feeling is not okay. And you practice making it stop. And what happens? You end up growing up with all these unmetabolized feelings. And that's chaos.
Yeah.
And so what you did is amazing. And these kids do learn. Like, that was one thing I in pediatrics, like I got to spend time with these kids on my night shifts. I would sit there and I would talk to them. And they were so aware. I had this one girl who was very, very sick. And she would tell me things about like not wanting to make her mom sad. But then she'd say like, oh, I had this dream that I went into surgery. I didn't make it. And she's like very matter of fact about all these things, understanding how it affects her mom. And I'm like, these kids are little gurus. Yeah. And they don't have a place to speak about how they experience the world. I have another friend, it was incredible. Her 5-year-old was telling me the story of how they decided to do a dopamine detox. Like he has his tablet and he was telling me the story. He's like, like it was hard, the first day, like, but he ends up saying how by the time the third day came around when I could get the device back, I actually didn't know if I wanted to because I wouldn't want to have to go through those first days again. So these kids also understand that like the devices aren't good for them, but they don't have the tools to actually navigate stopping. Like I have, this one teenage that I work with, she's like, oh, my parents will never hear that I wish I grew up without a phone. But they know. My nephew, same, so they're able to understand these things, but we don't treat them like the little gurus they are. And there's a great book called The Conscious Parent. And there was a line there that really stood out. It was that the parent-child relationship is primarily about the evolution of the parent and only secondarily about raising the child.
Oh, wow. Yeah.
In the Native American church, they call their children brother and sister because they understand we're all walking this together.
I had that same thing with my son. We went back and forth, and I know the hazards of the screens, and he wanted a PlayStation 5 for Christmas, and me and my wife went back and forth, and it was because I know, and we got it anyway. And a couple months into the new spring semester, his teacher called us, and my son is the sweetest, and she said he was having behavior problems, and I was like, that is not like him. And I ultimately deduced it to Fortnite and this bro coach culture that gets on here of they can do, and he felt like in that space he could say and become this other cruder version of himself, and then he couldn't delineate between the game and life where it was appropriate, and then he was taking that and that humor into the classroom to be able to do it. And we took it away for 30 days, and I had a good level set with him and had to show him hey, I think what's actually happening here is this, and I think what I've observed in this. And he was devastated, just absolutely, because he didn't even know what was happening. And but it's only because me and his mother are so present and tuned in that we were able to make the correlation and do that. And yet I know that there's all of these things that are attacking our kids, and that's one of the most important resources on our planet. It's the protection, safety, and welfare of our children, to create an environment for them to grow up in so that they can be their authentic expression. I love that it's the evolution of what the parents are able to do, and the kids are the byproduct of that. And I see that evidence so much in my own life.
And I think we assume normal, right? I mean, that's my biggest thing. It's we assume that our kids know how to grow up, and we're just going to call them out when they misbehave. And it's no, why don't you assume that your child does not know anything about what normal is, because normal is also a definition. Why don't we define that for these kids?
Yeah.
And then maybe if we define it, and then we see if there's, well, they did know. I do know for a fact that we have talked about this, and now they're deviating. Mm-hmm. Well, then you can look at it as negative, behaviors. But until they know about it, why are we holding them to such a level that they're
right,
end all be all little beasts?
So the idea of normal. So Gabor Maté, the myth of normal.
Yeah.
We have that. I also think we are seeing I find autism to be fascinating.
Oh yeah.
And I actually don't think that people with autism are here to be fixed. They almost feel like they're here to show us what's broken. Because, and I'm not talking about, the nonverbal, severe,
sure,
behavioral issues. I'm talking about the people who oftentimes the diagnosis is missed, particularly in girls, because girls are taught how to be friendly, how to be nice, how to ask people what they're doing. So they kind of miss some of the social parts. But for these kids, and I've spoken to many of them, they see the world differently. And what is normal, bullying is normal. Really? Because for them, they love purely and they believe in justice, so bullying is not normal. And so these kids have a really hard time with this. They're also oftentimes brilliant. And they're able to leverage the access to the internet to come up with these incredible ways of viewing the world, which is part of adolescent development. They are literally, their brain is completely neuroplastic. They are figuring out ways to be. They're supposed to challenge the status quo, and now they're going to their parents who are no, everything is fine. So they're being gaslit by their parents, bullied at school, and then they go to the doctor with all these diagnoses that are actually just normal responses to abnormal human behavior. Because the kids are assholes. We're not supposed to be assholes to each other. And social media inherently is not good or bad, but the way that it's used to isolate kids. And now you weren't invited to this party. when all you want is a friend. Like these kids, there's this misnomer that autistic kids don't want to be friends. No, they really want friends. Sometimes they're not skillful in developing these friendships. And it's like, how do we make the world okay long enough for these very special kids to figure out what their strengths are? And it goes back to what you said about figuring out like who you are and what do you want to do. I oftentimes ask people who are in the midst of a midlife crisis in the ketamine chair, and I'm like, who did you want to be when you grow up?
Yeah. Because
maybe there's some element of that got lost. And for these kids, like they have incredible skill sets if we just let them connect to those. We tried to fit them into this mold and it doesn't work for them. And I'm including like the ADHD kids as well. Like they have something in them, but we try to fit them into something else. Then we medicate them for not fitting into this thing. And now we've disconnected them from their gut feeling, from who they are. And now they're walking around almost lost, oftentimes medicated.
They lose their identity, Adam, what we talked about earlier.
Yeah.
Then you become misaligned and you start going down the path that you think you're consciously supposed to go down. And then one day, and one day you wake up and who am I? Like, why am I down this path? It's like you, right? Like with medical school.
Yep.
You had these big conflicts to where it didn't feel right, with all these things. And fortunately, you had enough audacity to drop out and to, move over this section. But, a lot of people don't, because a lot of people are very, very fearful about the financial status and all those different pieces. And, as we say, right, one of the Maslow's is shelter and food and all those things. So some people may prioritize those instead of feeling like, no, like this doesn't feel right. I'm not spiritually aligned with what I'm doing.
So Julia, it sounds like it's been like quite an incredible journey of discovery into like finding that, purpose and passion for you, and that you're working in that, now. What are you kind of excited about now or for the future? Just continuation of serving your patients, or is there any projects you're taking on in the near and distant future?
Yeah, so there's a book called Into the Magic Shop where this neurosurgeon talks about all these paths that his life took him on. And it kind of how I approach things. I'm like, whatever comes on my path that feels aligned. And so my coach guided me to say, what are your pillars? And so my 3 things are, heal the healers, save the children, build community.
Oh, I love that.
And so if any project helps me with at least like 2 of those, 3, even better, I get involved. So one of the things that one of the groups that I'm really excited about is this adolescent young adult ketamine-assisted psychotherapy group. It's about 80 providers, IACAP, and this is their demographic.
Okay.
And so there's a lot of, I get it. It's a very controversial thing, psychedelics, kids, but we've been using ketamine for kids in the ER forever. Right. Like this is one of our favorite use cases. And with a proper support, the emphasis on proper support, like if you have parents that are just like, can you fix my kid? Probably not the best kid to do ketamine for, because he's being put back into a very toxic dynamic. But you can give kids their life back. If you can give a 40-year-old their life back, you can give an 18-year-old a new direction.
Right.
So that's one group that I'm excited about. They're going to be putting out more content, starting to do more things with this. And it's a support group where you're like, hey, I'm the only one doing this? No, you're not. Okay, cool. So I can keep doing this. The other thing is I'm a co-founder of a tech startup that's currently in stealth, but it's aimed at really bringing to people the proper way to work with, yes, ketamine, but also any new medicine. Like I think the really exciting thing right now is AI is ramping up at the same time that healthcare system is being like judged, broken down. People are starting to see what it is and isn't, and how it's not actually healthcare, like it's sick care, and how do you take your health into your own hands? So now you're having these very intelligent, like AI that are able to make sense of your data, help you understand which direction to go, and then you're only following up with doctors that like you actually need to see, and really focusing on the preventative care side. So the startup is very psychedelic adjacent because like this isn't what our focus is, but our focus is like helping people navigate the plethora of information out there in a way that is most accessible for them, and helping the clinics that support these people along the way. And honestly, the idea of having this potentially be for kids, I think I've seen it in like some of the younger patients. They are lost. And to give them something that connects them to themselves so that they know what they can do, I think is going to address a lot of the issues we see with kids right now.
Yeah.
Because when you think of trauma in its simplest definition, it's any negative experience that happens in a state of relative helplessness. Kids with access to the internet are relatively helpless.
Yeah.
At baseline, they're relatively helpless because they're kids. But now it's like, I literally don't know what I can do. So what's the point of doing anything? And we need to give them some kind of connection to who they are so that they know that they matter and that they can do something, and like make it possible for them to connect to what their gift actually is. So they're not all just going to, the accounting because that's going to be good for whatever.
Please no.
Yeah, because we need them to bring what their skills are.
Yeah, and where can we like put them inside healthy communities as well?
Or outside in the wilderness.
Yeah. I love the 3 things: helping healers heal.
Yes.
Saving. What did you say for the kids?
Heal the healer, save the children, build community.
Heal the healer, save the children, build community. Yeah. And I love that you took the time to be able to really define like what are the core things that I want to give myself to, and I can do it in a lot of different ways, right? And I'm excited like when things fall into my lap that are, it's new, and it's like, oh, this is fun. I could enjoy this. I could, learn something new, bring my skills into it, and it's serving 1, 2, or 3 of these like core domains. And I think that's something that everybody should be able to do and really determine like who they are, how they're going to live through life, what are they going to give themselves to, what's the impact, and like what are they going to leave behind. Because if you're thinking about it like for yourself, you're thinking about it the wrong way. If you're thinking about it for like those that you love, your neighbors, and that which you brought into the world, like maybe you might be onto something.
There's like, how I said everyone's a coach. So
literally,
I think if trained properly, like if you become a coach as a father, you are now potentially helping your wife feel validated and your kids feel heard. Amazing. Now your kids learn some skills. They go and they do this for the pocket of their friends, and your wife brings it to another area. So to me, I almost think like maybe we should all just become coaches so we could be better to each other, so that therapy is not as needed because you have other people you can go to who will listen to you, not judge you, and support you in becoming your best self. Like, and maybe that is where we're supposed to
I love that.
go.
Yeah. Yeah. Like we should do that through like high school. It should be a high school course or something, Yeah.
Or at the beginning of med school.
Yeah. Or yeah.
Yeah.
There's a paper, I think maybe I've told you about it. I don't know if I've told you about it, Adam, but it's I admire people like Julia and Michelle and such because we're all true leaders.
And we admire you.
Yeah, thank you. We're all true leaders, but I was this is kind of a longer story, but I'll make it shorter. But basically in the ketamine space, a lot of people are like, oh, do you just treat like treatment-resistant depression, right? Because that's what ketamine's like, oh, no, treatment-resistant depression, right? And for some reason, treatment-resistant depression has gotten accepted for ketamine treatment, unless you're an insurance company, you decide it's still investigational just because you don't want to pay. So we honestly, like, I treat anything with ketamine if there's peer-reviewed data behind it and it shows that the benefits outweigh the risks, right? And adolescence being one of them. So one of the, talking about how I like search people down when it's a decision made that I don't agree with. There was a company that we worked with and they supplied me ketamine, right? And they supply hospitals and all that stuff. They found out I was treating more than just depression, even though ketamine is a dissociative anesthetic, which technically it's FDA approved to treat pain. Same day, they cut our contract. And they're like, we're not supplying you ketamine anymore. And, I went and sued them. I actually did all my lawsuit papers and got my lawyer to sign off on it. And, but I dropped it because now I have to work with them again. But anyway, it was just interesting, right? When you're seeing like if it's not depression that you're treating, Like they will pull the rug out from under you. An article that we just published back in February, and it's really interesting. I love to see this, and hopefully the guys can include this on the podcast with the article. But Frontier Psychiatry published it, and it was a 29-year-old male with ADHD, autism, bipolar, suicidal ideations, homicidal ideations, never had a car, never had a job. And he did ketamine, in conjunction with ketamine-assisted psychotherapy. And the therapist that sat with him during, he would feel the autistic population, sometimes they want to feel, right? When you said they want friends, they want to feel love, they want to feel joy, they want to feel all these emotions, but there's a really big barrier as to how they can't integrate those and feel those. So during the ketamine session, she would talk to him about love, what does love feel like? And he was able, became emotional during the ketamine session because he was able to feel that truly immersive sense of what love felt like, right? So, and he did amazing afterwards. He ended up getting a job, got a girlfriend, all these things, right, that he had never done in his entire life. And the only reason they brought him to us is because I think he came from 6 hours away. But they brought him to us because the family unit was so, he was a big guy. And they were so afraid from the homicidality, suicidality piece that they were going to get hurt, So we were the last ditch effort. And so, so we did this awesome case study. And literally, it's probably in 30, 40 countries across the world that people have looked at it. So, there's something there, right, with autism, ADHD, all these things. And looking at ketamine, looking at psychedelics, and really, yes, starting to use it on the adolescent population. I love adolescents with ketamine. They're amazing. They're beautiful. It allows them to autoregulate the speed of their thoughts in their brain. And a lot of kids, when they try to kill themselves, the parents are like, yeah, whatever. They've got a great life. And I'm sitting there with parent A and kid, and the kid's and I'm like, all right, well, what went on? And they're like, I was just trying to slow my brain down. And that's 100% of the time these kids that tried to kill themselves, they couldn't turn their brain off and they just wanted a break. So that's when they try to hang themselves or overdose or whatever else. And they're just looking for just a second of a way out, right? But it's ineffective coping mechanisms. It's the same way with suicide. I talk to people with suicide all the time. Suicide, to me, is not because you're depressed. Suicide is because you're trying to get out of a situation that you have no control over, and you're trying to regain control. You are trying to exit the building. And you're in such a state of survival, you don't care what's on the other side because you feel like you're in hell and you have no more coping mechanisms or strategies. You feel like you've used them all, right? And it's if we could have this risk mitigation aspect to where we can identify this up front and we say, okay, wait a minute. If you start feeling like you're out of control, step back and say, wait a minute, why do I feel this way? Or if you start having suicidal thoughts, okay, wait a minute, why do I feel out of control right now? And usually there's a lot of things on this counter side as to why you feel out of control. And if you can start to analyze those things, then you can passively start regaining that balance, right? And I tell people all the time, I'm like, all right, if you go kill yourself, where do you go? Who's to say that you don't start over again? I don't care what anyone's beliefs are. The truth's out there somewhere, Who's to say you don't go to purgatory? Who's to say that the grass is not greener on the other side? What if you get stuck in your own hell that you're in now? At least you're in the world to where you can make an option to change. And I think that's where ketamine and psychedelics are. That's why they're so important, right? Is because we know other things in the mental health system don't work. And even when they do work, they work in 6 weeks. And it's what are you doing, And we'll see. Julia's seen it. When people go into the mental health, right, the hospitals, they get committed. Usually they can, on average, get 8 to 11 medications prescribed at one time. These medications, they're stacking them, right? Because they're trying to get an effect. And I've talked to some really big mental health, and I said, why don't you get people in that are in this acute crisis? Why don't you do one ketamine infusion and you break the trigger that they're in, then you assess them, then you figure out the medications, because you all are giving long-term medications in an acute crisis situation, and none of it makes sense, right? But it's accepted.
Yeah.
And that's, when I'm sitting here smiling at Julia the entire time, I'm like, I used to feel so lonely as a leader. now I've got all these amazing people here, and it's cool. It's and it
That's how I
motivates you
feel
to
too. Yeah.
to keep showing up, because the world needs us.
What you touched on about the standard of care versus what you're suggesting. There was a book there's actually 2 books that are very pivotal for me that made me realize, like, especially as it pertains to the adolescent population, which could be from like 14 to now they say 25 because the brain's developing differently.
I'm 40. I still feel like I'm there.
Yeah. I'm with you. So one of the things that you touched on is, okay, you get admitted and you get medicated. And one of the books it was The Anatomy of an Epidemic, talking about mental health care. And it said that they looked at the numbers, and so they had people who were admitted with a psychotic episode, and they looked at them. They were either kept on medication or they took them off of medication before they got discharged. The ones that were kept on medication at discharge were less likely to be discharged at the 1-year mark and more likely to be readmitted at the 2-year mark, had been on Social Security, like on SSI or disability, and most of them did not get jobs. They were not functional members of society. The ones that were medicated initially acutely, and then the medication was stopped, they were more likely to be discharged at the 1-year mark, less likely to be readmitted. Most of them got jobs, significant others, continued on with their life, saying that psychotic break was one of the most important moments of their lives. So another thing with schizophrenia was never associated with suicides until we started medicating in the 50s. So then now there's like a big association between schizophrenia and suicide. It's like, okay, if you look at tribes, they'll take a person who hears voices, send them out into the wilderness. And when you come back, they're like, okay, you're now telling us what we need, when we need to plant the crops. So we treat these mental illnesses in ways that, like, again, trying to put it into a box. We can't burn the witches, but we can medicate them and hospitalize them forever.
Right.
And the sad thing in that book was like, okay, here's all the stuff about the mental health care, and now let's look at children. And there's another book, Children of the Cure, which talked about, I believe it was psil. And one of the stark things that it said was children were never, it was never shown that an SSRI on its own was effective in this age group. However, when a drug comes out, if they study adolescents, they get 6 months patent extension. So even though they know it's most likely not going to be effective, they're still going to study it because it's worth it for the $750 million that they're going to make in those 6 months.
Wow.
Now, I don't think that psychedelics for this age group is going to be something that comes from science. I think we're going to follow the trend of Charlotte's Web, where you had parents who took a massive risk, who ended up screaming at the top of their lungs that cannabis oil worked for their child, and then science started to pay attention. I think we're going to have the same thing with parents with psychedelics. We need to empower parents to make the decision. We cannot guide them. We cannot prescribe or recommend this technically, but we can say, here's what you are using for your kid. Here are the side effects that definitely exist with these medications. They become eunuchs. They become disconnected from their sense of self. It's harder for them to make bonds with people. This is what you're already doing. Here's a drug that has been safe since the 60s that has this potential, and let them make that decision, make an educated decision, give them the tools to make that educated decision because they are desperate and they think their kid's broken, but that's because they're being treated with a system that is broken.
Yeah. And I think we need to come up with a law. It's like the Good Samaritan law, right? We need to come up with a law to where if the risk is so high for a kid and providers recommend something, that the providers are going to be protected. Because what's happening right now is these kids are so high risk, providers are turning it around. And they're not even looking at these kids, right? And I tell my providers at the clinic, I'm like, if you turn away anybody, you are just as guilty if they walk away and they kill themselves. But they won't, because they think, well, I didn't do anything. I didn't intervene, so it wasn't my fault that they killed themselves. Yeah, it was because they came and asked you for help. And, and that's a really, really sad piece. And people, it is. Liability is so high. They want to be risk adverse. It's unfortunate. But our legal system rules the roost. Money rules the roost. greed and all these things. And yeah, we're losing a lot of people because of it.
Well, I think we're saving a lot of people because of people like y'all and the work that you do and the work that we do. And Julia, it's been really great to sit with you today and learn more about you and your path, unconventional path, but I think it's becoming more normal, and that's great. And it's only because of leaders like you out front finding ways to bring this online and bring it into reality, in a safe and thoughtful way. And couldn't be more appreciative to you and to also get to know you, and looking forward to staying in touch and figuring ways to support all the cool things that you have going on. Where can folks get in touch with you?
LinkedIn is good.
Yeah.
I also have a Instagram account, not too active, but I actually posted the Children of the Cure book and the Conscious Parenting book, just like in the story little thing, highlights where people can just skim through it, just because it was for parents, for like resources for parents.
And then going forward in the future, what's your focus right now?
The biggest focus is the startup, because it will allow us to essentially be like the connective tissue in this healthcare 2.0 to help people navigate everything that is confusing but promising.
I like healthcare 2.0. Yeah. We need to get those t-shirts. Yeah. Awesome.
Awesome.
Yeah. Thank you for having me.
Thanks for being awesome.
Likewise.
So now I'm introducing Cordyceps. Cordyceps is a natural mushroom, and Cordyceps is really amazing for your immune support. So if you have allergies, if you have asthma, Cordyceps is great. If you have thyroid issues, Cordyceps, again, is a great supplement that can help support your thyroid, as well as diabetes. So if you have sugar issues with regulation, Cordyceps is really a great way to go. Also, it helps with energy as well. So it's a great supplement to take in the daytime. You can take it with food, without food, and it's all natural.